When you start working on the hospital wards as an intern, it can be a bit scary. It is often fast-paced, and there is sometimes an expectation that you know everything about every patient. Many times a consultant will ask you, what are their oxygen sats? What's their potassium? What antibiotics are they on? And you'll spend a lot of time saying, I don't know. This video will help you be prepared for what the senior doctors are looking for. It will also highlight some of the traps. I'm telling you because these are mistakes that I've made along the way. Remember, every team, ward and hospital are slightly different. This is just an example from the hospitals where I did my intern year. The first thing is to arrive early. The first week I would arrive half an hour early. When you're more comfortable, 15 minutes should be enough. A nice consultant will sign off on this overtime. Print the lists of patients. Start by setting up shortcuts in your user preferences and make sure you're sending it to the right printer with the right paper size. Identify which ones are the new patients and the sick patients. Night cover can help with this. Then check what you're wearing. You'll need comfortable shoes, you'll need a stethoscope, name badge, swipe pass, good pen and a multicolour pen. Also take a disposable pen because a consultant will borrow it and walk away with it. Invest in a bright torch with a clip on it so you can inspect the wound while also taking notes. If you're on medicine, take a tendon hammer. If you're on surgery, take the dressing removal spray or wipes, saline and a bluey or drape. Then prepare your trolley. Get one with wheels at work, with a computer that works and isn't being used by the nurses to administer medication. Many computers are locked to stop you throwing them in the bin when you get frustrated. Then get the files you need. The consultant may only wish to see the new and sick patients, so put these files on top. Get a handful of radiology requests and pathology forms too. Be there to greet your team and give them each a copy of the list. When entering the room, identify if there are any contact precautions and hand the consultant the PPE. Don't hand the consultant a garbage bag as they look similar. See if you can find the patient's nurse. Be nice to the nurse. Ask the nurse to attend with you. Open the file to the last progress note and have a look at the previous day, especially if other specialties have reviewed your patient. Be comfortable holding the file as your arms will get sore. On the computer, open up blood results and past submissions on Jade Care. Open up the medication chart, open up sign-ups, and see if there are any recent changes. Open the bedside chart, check the vital signs, fluids, and blood glucose. At an appropriate time, call out any anomalies or changes. All this will need to be done while also taking notes in the file. If you're in a team, you can split the jobs between you. When the patient is being examined, pull the curtain. Sometimes the consultant will examine the patient and they won't relay their findings. Don't be afraid to ask if you're unsure. Ask what the plan is, note it in the file, and write it down on your list. If you hear that the patient needs investigations, grab a form and start filling it out while on the round. If you see someone filling it out, get a sticker for them. If you're not doing anything at any time, think about these tasks and make sure that you're ready. Then, before you get to the next patient, think about what you'll need. Once you see all the patients, be sure someone hands over to a nursing team leader. This is a good chance to catch up with anything you might have missed. Also, a chance to be nice to the nursing team leader. Once you're done with the round, it's often time for coffee. Paper round, over coffee. Use your multicolour pen to help organise the jobs on your list, and have a system where if you've ordered a test, check the results later. Divide up the jobs between the junior doctors, and if you find you've got too much work on, always ask for help. I know this is a lot to take in, but after a couple of weeks you'll be experts. Oh, and don't pay for coffee. Someone more senior should do that. This is honestly the best thing about being an intern. A summary. Arrive early, print the lists, get your equipment ready. Prepare your trolley with computer, files, referrals. Open the file, check the bloods, check the vital signs and other obs. Open the med chart and images. Write down the plan in the file and on your list. If you have time, order the investigations while on the ward round. Hand over to the nursing team leader. Do a paper round. Organise and divide the jobs. Check your results. Claim your overtime. Don't buy your own coffee. And be nice to nurses. Best of luck. I hope that helps.